Welcome to the entire Academy. I am Dr. Ovia Jagadish Kumar. In this video, I am going to explain about scalp and its layers. I have included every important points in a simplified manner with diagrams and pictures to help you study. Scalp is nothing but the soft tissues covering the cranial vault. The scalp itself is a mnemonic. It has 5 layers. First, we'll see the extent of scalp. It extends anteriorly from supraorbital margins, as you can see in the picture, posteriorly from external occipital protuberance and superior nuchal lines, and on each side, superior temporal lines. Now we'll see layers of scalp. The scalp has 5 layers: skin, superficial fascia or dense connective tissue, deep fascia or epicranial aponeurosis, loose areolar tissue, and pericranium. The first layer is skin. Skin is thin and hairy. They are attached to the epicranial aponeurosis through the dense connective tissue. The next layer is dense connective tissue or superficial fascia. This layer is more fibrous and dense in the center than at periphery. It provides proper medium for passage of vessels and nerves to the skin. The blood vessels are very adherent to the tissue, so scalp can be the site of profuse bleeding when laceration happens. Next is occipitofrontalis muscle, because this muscle is attached to epicranial aponeurosis. This muscle has 2 bellies, occipital or occipitalis, frontal or frontalis. The occipital bellies are small and separate. Each arises from lateral 2/3 of superior nuchal line and is supplied by posterior auricular branch of facial nerve. The aponeurosis passes between these 2 bellies. The frontal bellies are longer and wider and partly united in median plane. Each arises from skin of forehead mingling with orbicularis oculi and the corrugator supercilii as shown in the picture. It is supplied by temporal branch of facial nerve. The third layer is epicranial aponeurosis, also called gallia aponeurotica. It is freely movable on the pericranium. Anteriorly receives insertion of frontalis, posteriorly receives insertion of occipitalis. It is attached to external occipital protuberance and highest nuchal lines between occipital bellies. On each side, it is attached to superior temporal lines. Also, it sends a thin expansion that passes over the temporal fascia and attaches to zygomatic arch. The fourth layer is loose areolar tissue. Its extensions are anteriorly to the eyelids because the frontalis muscle has no bony attachment. It's freely movable, and posteriorly to the highest and superior nuchal lines, and on each side superior temporal lines. It includes numerous blood vessels including emissary veins which connect the veins of scalp to diploid veins and intracranial venous sinuses. Pericranium. It is the last and fifth layer of the scalp. It is firmly adherent to the sutures but loosely attached to the surface of the bones. The sutural ligaments bind the pericranium to endocranium. Thank you.